Hello, Long Beach. Today is June the 8th, and we are doing our Monday, Wednesday, Friday live updates to the community and to be able to ask any questions that the media might have. These, of course, were set up really around COVID-19. There's obviously a lot of other, particularly around racial justice and civil unrest has been happening across the country. And so we are speaking to some of those issues also and taking questions from the press on those as well. And so, but of course, I want to make sure that we're also focused on the issues as it relates to the health crisis that we're currently in as well. I want to just begin and take this opportunity. As you probably also heard, we lost a Long Beach police officer last week, Officer Anton Fisher. And it's just very, very tragic, I will say, for the department, of course, for his family. He was a young officer. And I just want to thank his family and his friends and his colleagues for just thank them for their support for his family, his direct family, but also to know that we're going to honor his memory. We'll continue to do so in the weeks ahead. We did a moment of silence at the last council meeting, which we had at the end of last week. And we'll continue to honor his memory. But I just want to my deepest condolences go out to the entire family and the Long Beach Police Department family as well. It's very hard to lose an officer, especially one that was so young on his way to work. And so our prayers and thoughts go out to Officer Fisher's family. I also just want to note that there's a lot happening as it relates to the peaceful protests that are happening across the country and the conversations that are happening around racial justice here at home and across the country. I was very fortunate to spend my morning today listening to youth from the YMCA Community Development Program. This is a program that focuses on young people, young adults. Some are middle school, high school age, some post-high school and college or the workforce. And that focuses particularly on communities that need support. These are families that have had challenging times, many of them. These are mostly kids of color. Many have experienced a trauma and difficult experiences in their own lives around injustice. And this YMCA program, which is led up by Bob Cabeza, who's a great community leader, is a critical one for our city that really uplifts and creates young leaders. And I had an opportunity to sit with them, physically distanced, of course, and listen to some of the young people talk about their experiences, their beliefs around racial justice and around equity and around what as a city that we can do better to support them and to support young people and to support our Black community, especially in Long Beach. And so we heard directly from them. It was a frank conversation. I want to thank them for their honesty. I want to thank them for inviting me and giving me a chance to just listen. And I continue to have that conversation with additional groups and community members in the days ahead. So again, to all of them, thank you for standing up and addressing systemic racism as you did today. And I want to thank that entire program for their work. I also want to just update before we switch to COVID. We've had now, as we're all aware, a full week since Sunday evening of peaceful protesting. And even Sunday began, as we know, as a very, very peaceful protest that turned into some taking advantage and looting and causing crimes that was just horrifying and angering to see in our city. Those small businesses did not deserve the type of looting and crime that happened to them. We know that, of course, a vast majority of that protest was very peaceful. And since that evening, we have had close to 13 or 14 protests in Long Beach, all peaceful, no loss of life, and only one major structure fire that affected a business. But we also know that there were dozens and dozens of businesses, small businesses especially, mom and pops, all types of businesses that were affected by looting or vandalism that night. Some businesses had a window smash, perhaps, or damage because of graffiti or damage to a storefront. For other businesses, it was much more serious. They had looting. Their stores were ransacked. A lot of damage was caused inside their small businesses that was going to cause those particularly small mom and pops a lot of pain, and for many of them, their life's investments. And so I want to announce today that the city of Long Beach is going to be addressing this issue. I'm going to be presenting and proposing to the full city council a new grant program, a Rebuild Long Beach grant program for every single business that was affected because of the looting that happened Sunday evening. So if you are a small business, and whether it was a small vandalism, a broken glass, whether it was that your business was a complete loss and your goods were damaged or all stolen, we are proposing and putting together a program that's going to provide direct city resource assistance to you and your business. We'll also be providing access through this grant program to advisors to advise you on how to navigate special loan programs, to help you navigate your insurance program. And so my commitment and our commitment as a city to each and every single small business owner is that we are here for you. We will not forget you. We will help every single one of you rebuild your small business back to where it was before that looting started. And so how are we going to do this? I'm already working with members of the Long Beach City Council. This will be in front of the Long Beach City Council on June the 16th, which is the following Tuesday, next Tuesday. Well, they'll get a chance to dialogue and invest in how we create this program. But it's going to be direct resources from the city. And we know that these are tough economic times for the country, but this is something that must be done, and we must invest in these businesses. If you are an affected business, please, you can contact us at 570-4BIZ, 4BIZ, to give us your information so that we can keep you on this list as we begin to work with you, or you can email us at businessdevelopment@longbeach.gov. You can also contact many of the business improvement districts that are all across the city, and they're going to be our conduit also to connect and figure out what businesses need support and how we get you that support. So you have our commitment to help every single one of you in any ways that we can to help you rebuild your small business. And so thank you, and help is on the way. Now I want to turn and transition to COVID-19. Let me just begin by saying that we absolutely have a crisis in this country as it relates to racial justice and equity, and we're seeing it every day on our streets. But we also have a very serious health crisis. This is a crisis that now has cost our city 100 lives. This is, we are experiencing a huge loss of life because of this virus. That is more, this virus in just a few months is the leading cause of death in our city when you're looking at things like other types of violence or accidents. This is a serious health crisis. And as a country and as a city, we are trying our best to manage, and in light of the protests that are happening, to also keep folks safe. More people now are out than ever before and interacting more than ever before. And this is causing, obviously, additional concerns to ensure that we're keeping everyone safe. I want to review some data with you today, because as you probably heard, the governor has made a series of announcements which we're going to talk about. Let me begin by just going over some slides that you've seen before, but it's important for the community to get updated. The slide you have in front of you right now is our COVID-19 cases by episode date. As you can see, the yellow line is actually the average. Yes, we are seeing more cases, and we know that part of that is because we're just testing a lot. So we've increased testing, and for those testing sites that, of course, we had to close because of some of the unrest we were seeing in the city. Almost all of those, of course, now reopened, and so we're back to testing. We've done about 45,000 tests in Long Beach, but you are seeing that those cases by episode date slightly increase, and you're beginning to see those increases happen, regardless of the fact, I think, that we are doing so much testing, and our health department director can speak to that as well. You're also seeing in this next chart are COVID-19 cases by 100,000. Now, Long Beach is represented by the light blue line in the slide, so as you can see, while we continue to track behind, well, you could say ahead of the state for cases per 100,000, we are doing comparatively better than the rest of the county, and that continues. And so the cases per population continues, and also the cases of deaths per population. So if you look at this other chart, which is deaths per 100,000 in population, you could see that we still are tracking below Los Angeles County and above the state level rate. Each of these deaths that I just discussed is serious and tragic, and our thoughts, our prayers, and our support go out to all those families. And we know that most of these deaths, vast majority, have been there have been other serious underlying conditions and have been linked to a lot of our long-term care facilities as well. And so we understand that, and we know that as we move forward. I want to show you this next graph. This next graph is hospitalizations over time. Now, I would say that this should be our most concerning metric that we're looking at right now. This is our hospitalizations over time. And we have said from day one that if this chart is one that should concern us as we move forward. Now, as you can see, there's two bar graphs there that are reported, and the lighter graph, you have hospitalizations on reported date, and then the updated number, which is the chart, the numbers that go higher, because as we get reports, they don't always come in on the date. Sometimes they come in a week after, and so those get updated, as you can see in the chart. But the hospitalizations increased, and they absolutely, if you look back and start going back into early mid-May, you start seeing a definite uptick. Now, I will tell you, and our health director can explain this better than I can, which she will in a minute, the hospitalization rate still tracks. There's a over 7-day average of a 5% growth in day-to-day hospitalization. We're still within that 5% that the state has set out. And so while we're heartened by that, the numbers are there, and we have to be very cautious of how we move forward. This next chart is again critical. This is our area hospital information. Our hospital bed usage right now is about 56%. So we do have, of course, our hospitals still have significant capacity to bring people in if people need help. We have an additional 441 surge beds if needed anytime, and the beds at the convention center. Our ventilator use remains around 30% to 29%. That's where it's been for the kind of couple months in the past. And so that means that there's obviously we have significant ability to help people if they end up in the hospital. The issue is we don't want people to end up in the hospital. So we can manage it. Right now, our hospitals can manage the crisis, but we don't want folks to end there. And that's something that we're very concerned about in this process. Let me now add about what's next. So first is the governor on Friday, I believe it was Friday or over the weekend, announced a series of new industries that can begin to reopen in the weeks ahead. In fact, I believe that this Friday is the first possible date that some of these industries can begin to reopen if counties and cities end up moving in that direction. So the types of new businesses that he put out there include gyms and fitness studios, bars, traveling for hotels, production of TV and film, day and youth camps, museums like our Aquarium of the Pacific, are all areas that he believes the state can safely move into if local counties and jurisdictions feel it is safe to do so. We are reviewing all of the state guidelines as we speak. Our health team is completely on this, and we expect to have, over the course of the next couple of days, announcements of how we are moving forward. And of course, we are working with our regional partners. As a reminder, we have a variance process that we went in with the County of Los Angeles on to be able to reopen some of the activities that have already reopened. And so we're working with our regional partners and the state to see where Long Beach is going to end up on these different industries. And we expect to have a lot more information for you on Wednesday about those industries. However, what I do ask is if you are a member of one of these industries, a bar, a gym, a fitness studio, hotel, production, it's important for you to start getting ready. And what I mean by that is I would visit the california.gov, it's ca.gov, the state website on the COVID-19 section, and you can download today guidance from the state on how to reopen safely. So we don't want businesses just to wait. We want people to prepare, because as we can see, if you are one of these areas I just mentioned, you are next on the list per the state. If you are not in one of these areas that I mentioned, the state is not allowing any other uses yet. And so please go to the california.gov website, download the guidance, begin to look through that guidance. We're also going to have links on the health department website, from what I understand. And we're going to have all of the announcements as it relates to these industries over the course of the next couple of days, so that people have time going into the weekend to know what will be allowed here in the city of Long Beach. And with that, I want to just to get into a little bit more details about some of our health indicators. I'm going to have our Director of Health and Human Services, Kelly Colopy, come up and give some more details and some more announcements. Kelly.
Good afternoon. Thank you, Mayor. About 2 weeks ago, I discussed the requirements that the state set forward for a variance so that you could move more quickly through the different industries. And we did apply with LA County, but we've been tracking on our data here as well. These indicators focused on current readiness to open and included shelter capacity, stable hospitalizations, testing positivity rate, the hospital surge, testing capacity, and skilled nursing facilities. We met the criteria at the time that we applied with LA County, and we continue to meet the criteria moving forward. More recently, the state came out with what they're calling stability criteria. These are criteria that you track on to determine if your numbers are going up too quickly, and if you need to be paying, if you need to sort of hold back a little bit moving forward. So these are sort of the checklist and the thing that you really pay attention to determine if you're moving too quickly. Now, granted, all of these numbers do not include the week of protests and the opening of restaurants and others last week. But as of now, we currently meet all but one of those criteria. So we've looked at our tested population, and we meet that. We meet the stable hospitalizations, the testing positivity rate, which is up at about 7.3, but is still below the 8 that was previously required and continues to be required. The one that we do not meet is our case rate. It says to be under 25 per 100,000 population, and we're at about 100 per 100,000 population. So that is something that we will continue to track on and really be paying attention to, and that would cause us, that and the hospitalizations, to really think more strongly about how we open moving forward in the city of Long Beach. We do have capacity in terms of our ICU beds, which the mayor shared, as well as the ventilators. So those are the numbers that we continue to track on, and we'll be able to bring back to you on a regular basis. So I do want to, move forward a little bit and just talk about our numbers right now within the city and our COVID numbers. Racial injustice, protests, and safety continue to demand our attention, and that focus continues to be essential. However, we cannot set aside the focus on the COVID-19 pandemic. In addition to the public health crises of systemic racism and injustice, the COVID-19 health crisis looms large here in Long Beach and around the country, as so many are taking public and powerful stands to support justice. As of today, we had 2,273 residents who have tested positive for COVID, approximately 1,662 folks who have recovered. As the mayor said, we're sad to report that we have hit that 100 mark for deaths within our city. About 3/4 of those deaths are associated with long-term care facilities. So I want to talk a little bit about contact tracing. I've shared with you the importance of contact tracing. It's something that the state is focusing on heavily, and we are as well. One of the initial criteria is the ability to move through the variance process is to have a robust contact tracing ability. Contact tracing and self-quarantining are critical strategies to help slow the spread of COVID-19. These measures have been used for decades by local and state health departments, and they're highly effective at controlling the spread of infectious diseases. When someone tests positive for COVID-19, our health department staff will work with them to recall everyone with whom they have had a close contact with while they've been infectious. Then the health department staff begins to contact all those people and warn them that they were exposed to an individual with potential, or that warns them of a potential exposure as quickly and as sensitively as possible. To protect patient privacy, contacts are only informed that they have been exposed to a patient with COVID-19. We do not share the name of the patient that they were exposed to. Contact tracing is your way to impact the lives of many in Long Beach and beyond and help stop the spread of COVID-19. So here's how you can help. If the health department calls you, please pick up the telephone. Follow your health department guidance. Notify your healthcare provider if you become ill. Make an appointment and get tested at one of our 6 testing locations in the city of Long Beach. Testing is free and accessible to anyone. If you have been in close contact with someone with COVID-19, you should stay home and self-quarantine for 14 days, starting with the most recent day that you were near them. Monitor yourself and maintain physical distancing at least 6 feet from others at all times. For more information about how to quarantine, please refer to the home quarantine instructions on our website. If you become ill, you must self-isolate and notify those who had close contact with. There's also home isolation instructions on our website, and I ask you to please refer to those if you are asked to isolate. Seek medical care if symptoms become severe. Severe symptoms include trouble breathing, persistent pain or pressure in the chest, confusion, inability to wake or stay awake, or bluish lips or face. We have been working very closely with the state, both on training of our contact tracers, as well as moving on to a statewide platform. So while our local health department has been doing contact tracing for a long time, Long Beach began piloting the new statewide contact tracing platform for COVID-19 last week. This is called California Connected, or otherwise known as CalConnect. We are gradually onboarding reassigned city staff to start learning CalConnect. So far, we've had about 70 trained in contact tracing, and we've had about 40 folks trained on the app. As more businesses open and people continue to exercise their First Amendment rights, this platform will expedite the city's ability to efficiently investigate COVID-19 cases in the months ahead. CalConnect allows us to conduct case investigations and contact tracing on a really simple platform and allows us to onboard larger groups of people very quickly. Data collected through CalConnect is kept confidential. It's protected by California's strict privacy laws and will not be shared with any other city department or law enforcement. The data are not collected and stored, the data are only collected and stored for use by local and state public health departments. Your identity and health information is always kept private. It will not be shared with anyone who may have been exposed. You will not be asked about your immigration status during testing, care, or follow-up calls. You will also never be asked for your social security number or payment, financial information, or banking information. Participating in contact tracing is your way to impact the lives of many in your city and beyond and help stop the spread of COVID-19. With that, I'm turning it back to the mayor. Thank you.
Thank you. I know that some of the questions might be for Kelly or for me, so if there's any press questions, we'll take those and then we'll answer as they're asked.
All right, Mayor. The first question is from Melissa Evans from the Long Beach Post. Go ahead, Melissa.
Hello. How are you guys? So I'm not sure what to ask here. I was going to ask about hospitalizations, but I think you addressed that. On the reopening side, is there, given all the protests over the past week and some of the numbers that you talked about, specifically hospitalizations and the city's rate of infection, is there any discussion that we may delay some of the reopenings that are now allowed by the state?
I think the answer to that is yes. And so that assessment's being done and being made right now by the health department and our partners at County of LA and the state. I want to make sure I'm very clear. The list of industries that I listed are all industries that the governor said can begin to reopen. That's not an exhaustive list of what is necessarily going to reopen in Long Beach on Friday or over the weekend. That decision is currently being made and discussed by the health professionals. So it could certainly be that some of those industries move forward if we feel that they can be done safely, if the medical professionals feel that can be done safely. But that's being decided and discussed as we speak. And I think that there'll be a kind of a unified answer on which ones open up in the next couple of days. But we did still want those industries to know that they're quote unquote next in line per the state guidance. So they should start downloading the state guidance and getting prepared as we make those decisions as well. Did that answer the question? I think so.
Yes, thank you, Mayor. The next question is from Philip Zonkel. Go ahead, Philip.
Hi, can you hear me?
Yes.
Great. I have two questions for the mayor. First question is, since the beginning of the pandemic, the public has been restricted from making live comments during city council meetings. The public is required to email comments, which places an undue burden to exercise their right to question public officials. When will the public have access to ask live questions during city council meetings?
So I think
Other question is,
let me answer that one. Okay, go ahead, Phil. Answer the second one.
am I on or am I off?
No, yeah, please ask the second question and we'll answer it.
Okay, I heard beep. I wasn't sure if I was on or off. Second question is, these virtual press conferences don't really allow press ample access to question public officials. Asking questions is difficult sometimes with technology. Follow-up questions are also difficult, and the questions are limited. So I'm wondering when this format will be improved to allow the press better access.
Okay, I got those questions. To answer the first question, obviously, because of COVID, a lot has been changed around the way public meetings are allowed because of gatherings, and the governor did put in guidance on how these public meetings can happen. I do know, to the response to your first question, I do believe later today, because she talked to me this morning, the city clerk is putting out some guidance about live public comment, so we can start transitioning back to those, I believe, next Tuesday. So that would be a week from now. We're going to try to transition back to a live commenting format. So if she hasn't put out a kind of a press release announcement on that yet, and maybe she hasn't yet, she did mention it was coming out today. And so we understand that it's been difficult not being at City Hall. Obviously, everything is remote and not being able to have the kind of public questions or the public comment that we normally had. So even though everything that the council has been doing has been kind of following state guidance, she's going to begin reincorporating a public commenting system that we believe will work beginning at the next meeting. And so she'll be putting that out. That answered, I think, your first question. The second question was, as far as these updates, we are doing these updates the best we can with the advice of our health department to limit the amount of folks, obviously, because of COVID. And so this is how they're currently being done. We're always looking, the safer the city gets, the more we can relax some of this stuff. But that's how they're currently being done right now because of COVID. And there's very few people in this room. Next question.
Mayor, the next question will come from Melissa Evans, again from the Post. Go ahead, Melissa.
Hi, thanks. I wanted to ask a question on behalf of another reporter here. It has to do with the unrest on Sunday. There was, police had said that they put up barricades in parts of Belmont Shore in preparation for the Sunday protest. But there weren't any barricades put in other areas of the city. And you mentioned some of the grant program that's going to be going to help all businesses. But I'm just wondering what went into the decisions as far as what areas of the city to protect with barricades?
I don't think that's true. I think, and Melissa, I could be wrong. I think the police chief would know this answer completely because he is the one that made the call on where barricades should go. But I think, and I'll verify this, that there weren't barricades up, I don't believe, on Sunday. I think the barricades went up starting on Monday evening, which was the day after the initial protest and unrest. And then I do think that barricades went up in parts of downtown. I want to say parts of uptown. There were some barricades that were put up, maybe along Atlantic, Bixby Knolls area. and there were also some that were put up on 2nd Street on the east side. Barricades were put up because the public safety team, because of whether it's information that they received or from a safety perspective, put those up. But I don't think any went up before. So I will check that, but I'm pretty sure that's correct.
Mayor, the next questions are some written questions that we received from KABC 7 from Julie, and this is really addressed towards Kelly, and this is more along the lines of some health department related questions. Kelly, a couple of these questions relate around testing and the number of cases, and one specifically relates to the protesting. And do you advise people that protested to go get tested?
Yeah, so if you have any symptoms whatsoever, I do advise you to get tested for sure. We are also doing testing for folks who are asymptomatic. So if you have been with a lot of folks, no face coverings, close contact, it may make sense for you to get tested moving forward. So you can get onto the COVID-19 website and make an appointment at any of those sites.
Great. And there's a couple more questions. This is specifically about resuming testing efforts. Have we resumed all the testing efforts at all of our locations since the protesting began? And then have we expanded any testing efforts? And do we have a plan to expand testing efforts?
All sites are open, operating as they have been. I think they opened last Wednesday or Thursday. So those are fully going. At this time, we don't have expansion efforts. Instead, what we're doing is the mobile testing. So we have created a lot of opportunities for people who can't get to test sites, maybe if they're in a skilled nursing facility or they're at home and they can't get there. So we have created better capacity to be able to get people tested. We don't have any additional drive-through opportunities at this time.
And the last question is related to health do we anticipate a surge or a second wave based on all these activities that are going on? And if so, are we prepared?
Yes, I'm watching the data nervously from the protest, I will tell you that. So it takes about 2 weeks for it to show up. So the first protests have been a week out, so we have at least another week of looking at our data. Restaurants opened at the same time as did salons. All those were happening over the same weekend. So we are going to be watching all of that. Moving forward. So I think that we will have an increase, whether I think it's a spike or just sort of a general surge. I'm not sure what that looks like. And then the state is starting to look at various things, and they're thinking that there could be later surges this year. So we want to make sure that we are prepared for everything. We have hospital capacity, we have ventilator capacity for people who get really ill. We have testing capacity to be able to handle people who have symptoms, but we're doing everything we can to minimize it. So I do ask you, if you become ill, to keep a nice list in your head about who you've been around for some close contacts that you can help share easily. The whole point of contact tracing is to be able to learn about people when people are tested, learn about who they've been around, and be able to quarantine as quickly as possible so that we're not going out and it's not being expanded further. So we ask you to make sure you're getting tested and then making sure that if you are positive that you participate in our contact tracing.
Thank you very much, Kelly. Appreciate that.
I'm not sure if there are any more questions.
The only last question that we really had was more along the lines of the opening, and obviously you've talked about this, the gym, nail salons, and massage efforts. One question that we did have is some massages are allowed in chiropractic offices. Why not in a private practice? And that was also in addition to swimming pools and libraries. So we've talked about that. If you want to elaborate on that, you're welcome to.
I don't think the governor, Kelly, did you want to answer that question? The governor didn't talk about nail salons. I don't believe. So I don't think that's something that's being contemplated yet. You did mention, what else? What other?
So one of the questions was, since massages are going to be allowed in chiropractic care offices, why not in private practice?
Do you know the answer to that?
Massages in a medical office are considered an essential service. Massages outside of a medical space are not considered an essential service. It's essentially the split. I do want to say that swimming pools are covered under this next opening with fitness facilities. So as we are opening fitness facilities, swimming pools will become one of those options moving forward. Libraries remain at a space of curbside delivery.
Well, Kelly, while you're up there about pools, the last one, and I'll just leave it at this, is the beaches. The beaches, we've always talked about active use. And what's the guidance moving forward as we start to touch into phase 3 about beaches and passive use, people sitting in and enjoying the time in the parks and beaches?
Beaches for sitting are still not open under the order. They're not open at the state level, so we really are tracking on that. I think we see a lot of family units, so we do have it for active use. And what I see, I live in Long Beach. I go by the beaches fairly often. What I see is families sitting near the beach and their kids are swimming and playing, and that is sort of an active use. They're out and they're around with them. We do still discourage folks from going to the beach to sit, especially if you're sitting in groups of people that aren't in your household, and with groups that you're not distancing with. So anything you can do when you're visiting a beach, we ask you to to really take your distancing seriously moving forward.
Thank you, Kelly. That's it, Mr. Mayor.
Great. We're going to have Alice from the Health Department who's going to do our Spanish translation recap. Thank you.
Gracias, alcalde. Gracias a todos por estar con nosotros. Este es nuestro resumen del lunes 8 de junio. Sabemos que esta semana pasada fue una semana muy pesada para nuestra comunidad y para nuestra nación. Queremos hacerles saber que estamos trabajando juntos para asesorar que nuestras organizaciones y algunos de los negocios que fueron afectados por las demostraciones y protestas que podamos ayudar y brindarles algún apoyo, pero habrá más información en el futuro. Queremos tomar esta oportunidad también para rendir un homenaje a uno de nuestros heroicos oficiales del Departamento de Policía de Long Beach, que entre su transición al trabajo el jueves por la tarde en un accidente de auto perdió su vida. Son nuestro pésame para su familia y para todo nuestro Departamento de Policía. También queremos enfocarnos hoy, recordarles que todavía es un tiempo de una pandemia. El coronavirus no se ha ido a ningún lado y queremos asesorarles y recordarles la importancia de para mantener prevención de alguna otra resumen de números que puedan subir los datos del coronavirus. Hace momentos vieron unas ciertas imágenes de datos y información que presentó nuestra directora Kelly y el alcalde García. La imagen número 1 fue casos por episodio de fecha. Hemos aumentado considerablemente nuestra capacidad de pruebas en nuestras 6 ubicaciones y desde hoy reabrimos todos nuestros sitios. Sabemos que estos últimos días tuvimos que cerrar algunos de nuestros sitios, pero desde hoy todos los sitios están abiertos, no más que algunos sí tienen algunos horarios modificados. Ahora, desde hoy, hemos realizado casi 45,000 pruebas en nuestra ciudad. La imagen número 2 fue una imagen que nos dio datos sobre casos por la población. Nuestra tasa de positividad ha disminuido constantemente. Eso significa que la parte de los positivos de todas las personas que se han evaluado se han reducido también. Recuerden también que siempre dura 2 semanas, 14 días para ver si a veces las personas salen con síntomas. Eso es muy importante ahorita que hemos visto estas demostraciones y protestas. Todavía tal vez no sean necesariamente se ven las enfermedades todavía van a salir. Significa también que puede estar todavía en el tiempo de que no salen los síntomas y tenemos que esperar. Normalmente estamos viendo nerviosamente los datos e información y significa que tal vez nuestros sitios van a estar un poco más ocupados también y que nuestros números positivos también por alguna manera puedan subir de nuevo también. La imagen número 4 es hospitalizaciones a lo largo del tiempo. Nuestros hospitales se informan diariamente, pero con el tiempo los números cambiarán a medida que recopilemos información más precisa. Actualmente tenemos muchas hospitalizaciones asociadas con residentes de centros de atención a largo plazo y que tienden a tener periodos de hospitalización más largos. Por eso estamos monitoreando de cerca las tendencias que vemos en estos sitios. Nuestros datos, la imagen número 5 nos enseñó datos del hospital del área de Long Beach. Nuestra capacidad de hospital está estable y adecuada, por lo tanto, tenemos un total de casi 1,500 camas en el hospital en toda la ciudad y una capacidad de aumento de más de 400 camas. Nuestro uso y la cantidad de ventiladores de respiración continúan siendo estables también. Nuestras camas de hospital tienen el 56% de capacidad y por lo menos 29% de nuestros ventiladores están en uso en este momento. A partir de ahora, muchas actividades están permitidas nuevamente. El gobernador tuvo algunos datos esta mañana también. No podemos volver completamente a la normalidad, pero nuestras hospitalizaciones y las muertes siguen aumentando también. El distanciamiento físico sigue siendo muy importante con más personas en la comunidad y ahora es más importante que nunca también. Gracias por continuar cooperando con nuestras órdenes de salud. Nuestras acciones que hacemos día a día ayudan a salvar vidas también. Nuestra directora nos dio algunos datos sobre las indicaciones que ha puesto el estado de California para reabrir. Los criterios actuales de preparación del estado se enfocan más en la capacidad del refugio que es necesitado, hospitalizaciones estables, pruebas de tasa de positividad, capacidades de pruebas, una oleada hospitalaria y instalaciones de enfermería especializada. Y desde hoy, en este momento estamos cumpliendo con todos esos 6 criterios. También tenemos criterios de estabilidad en la ciudad de Long Beach y en cuanto a los criterios de estabilidad, estamos cumpliendo todos los indicadores menos uno. La velocidad de caso por 100,000 personas y el probado de población, que son también de 100,000 personas. Y desde hoy, entonces, tenemos 114. Números de coronavirus. A pesar que los problemas importantes relacionados con la injusticia racial y la seguridad exigen nuestra atención en este momento, recordamos, como dijimos la semana pasada, es un problema de salud pública también. Todo lo vemos debajo del mismo lens, y a partir de hoy tenemos 2,273 residentes en esta ciudad que han probado positivo del coronavirus. Aproximadamente 1,662 se han recuperado. Y nos entristece informar que ya hemos llegado a 100 residentes que han perdido su vida al coronavirus. Es muy importante también que les platiquemos un poquito sobre la importancia y el seguimiento de contactos. El rastreo de contactos, recordarles que todo es confidencial. Honramos la privacidad de todos los pacientes y todas las personas que salen positivos del coronavirus. Pero es muy importante que cuando el Departamento de Salud recibe una prueba positiva y les llaman por teléfono, que por favor es muy importante contestar las llamadas, aunque no reconozcan el número que les llame. Es muy importante seguir las instrucciones, tratar la manera de mejor responder a todas las preguntas que se le hacen, especialmente cuando le preguntan con quién ha estado junto, por ejemplo, ha ido al trabajo. Cualquier persona que si ha salido positivo, ha estado en contacto con una persona específicamente en su casa, en su hogar, en el trabajo o por algún lado, es muy importante darle toda esa información a la persona que le llama, porque es la manera que las investigaciones y el rastreo es más efectivo. Obviamente, como les digo, para proteger la privacidad de los pacientes, solo se les informan los contactos que pueden haber estado expuestos a un paciente con el coronavirus. El Departamento de Salud no comparte la identidad del paciente que puede haberlos expuesto. Esa información, los nombres, solo se les avisa o usted le recomendamos que se haga una prueba porque tal vez estuvo expuesto con alguna persona que salió positivo, por ejemplo. El rastreo de contactos es una manera de impactar las vidas de muchos en nuestra ciudad y más allá ayudar a detener la propagación del virus. También queremos explicarles un poquito del programa de rastreo que está en los planes del estado de California. No nomás nosotros como nuestro propio departamento de salud que tenemos en la ciudad de Long Beach, pero también en el estado. Estamos incorporando gradualmente al personal de la ciudad para comenzar a aprender al programa que se va a llamar CalConnect. Alrededor de 70 empleados de nuestra ciudad han recibido entrenamientos hasta la fecha. A medida que se abran más empresas y las personas sigan ejerciendo sus primeros derechos de enmienda en esta plataforma, acelera la capacidad de la ciudad de investigar eficientemente los casos de coronavirus para los próximos meses. CalConnect nos permite realizar investigaciones de casos y rastrear contactos en una plataforma simplificada y nos permite incorporar grupos más grandes de personas más rápidamente. Su identidad e información de salud siempre mantendrá privada. No se compartirá con nadie que haya estado expuesto. No se le preguntará sobre su estado de migración durante las pruebas de atención o llamadas de seguimiento. Tampoco se le pedirá nunca su número de seguro social, información de pago, financiera, bancaria o ninguna información de sus finanzas privadas y cosas así. Participar en el rastreo de contactos es una manera de impactar las vidas de muchos de nuestra ciudad y más allá y ayudar a detener la propagación de este virus. Es toda la información que tenemos. Sigan siguiendo las órdenes de salud, quedándose en el hogar, pero recuerden que también es importante seguir practicando sus derechos. Muchas gracias y gracias.